Hi friends, I'm Dr. Monica Bamru. I'm a practicing dermatologist for last 18 years. Today I'll be talking about a very interesting topic which all of you seem to be worried about, and that is hair fall. Hair fall has emotional overtones. We all worry about hair fall. And who is not involved with hair fall? We have kids with hair fall, we have elderly, the middle-aged, the young females, after pregnancy. So hair fall is like a universal thing. But many a times we feel that a lot of people feel, is this the amount of hair fall which I'm having? Is it normal? Or is it really some problem? Should I seek the opinion of an expert? So I'm going to answer some of these queries. So one thing we have to remember is that all hair fall is not abnormal. Some hair fall is natural and normal. If we lose 100 hair, 40 to 100 hair on a non-shampoo day, we consider it normal. And on a shampoo day, you can lose as much as 100 to 400 hair. So therefore, the days when you wash your hair, you can have more of hair fall, and the days when you do not wash your hair, you can have less of hair fall. So this is a normal phenomenon. Now, what happens is there are a lot of conditions that can lead to hair fall. So we primarily divide hair fall into two basic categories. One category is which is known as non-cicatricial or non-scarring alopecia. That means you are losing hair, but you have every chance of getting back your hair. That means even if you have lost hair, you can get back your hair. The hair growth can be there. On the other hand, we have another kind of hair fall or another kind of hair loss which is known as cicatricial alopecia. Cicatricial alopecia means that the hair follicle becomes dead forever and there is no chance by any medication or method to get back all of that hair that you have lost. So cicatricial alopecia fortunately is very, very rare. So most of the patients that we see, they are of non-scarring alopecia or the alopecia or hair fall where you have chance of getting back your hair. Now this non-scarring alopecia can further be divided into those category of people who have pattern alopecia. That means patients lose hair in a particular pattern. In this we have two basic things. We have male pattern and female pattern. In the male pattern, which is very common, it's a common baldness or androgenetic alopecia that we see. Here you have patients who lose their frontal, there is a frontal recession. You see the hairline is going back. You will see a vertex thinning. And finally, you see that the entire hair from the frontal scalp is gone. That's a common baldness that we see in men. In females, also we have this kind of baldness. But here we have widening of the parting. So the parting widens. So these are the two basic things which are known as pattern alopecia, and pattern alopecia often runs in families. On the other hand, sometimes we get hair fall without any family history or without any apparent cause. So this is the time when we realize that we are just losing hair, and there can be either hair thinning, that we see that we are just thinning, the scalp is visible, or there can be hair shedding. We can actually see a lot of hair fall on the floor, on the pillow, while having a bath. Now, sometimes what happens, there are certain conditions which can lead to this hair fall. You can have it after a high-grade fever, like a viral fever or a dengue fever can sometimes lead to a lot of hair fall. Post-pregnancy, people have a lot of hair fall. Then it can be related to some medicine which you are taking. And one of the most important causes of hair fall, what I notice in my patients nowadays, is because of various deficiencies. Our food habits have changed, and because of the change in the lifestyle, we are noticing that there are a lot of deficiencies that people have. Vitamin B12, if you are a vegetarian, you can be deficient in that. Vitamin D deficiency can be that. Then there are a lot of people who have normal hemoglobin, but they have non-anemic iron deficiency. So their iron is low. So that can be another reason why we are losing hair. Sometimes the proteins, the hair is made up of a very important protein called keratin. And if our protein intake is not appropriate, we can still lose hair. Now the question is, whom should we consult when we have hair fall? The dermatologist is the best trichologist. The dermatologist has studied the whole physiology and anatomy of hair, and they are well versed with most of the conditions related to hair. So the best trichologist is the dermatologist. So first thing is that the hair, first we have to diagnose what is the cause of hair fall. Only when we know what's the cause can we do the treatment. So the cause of hair fall, if it is pattern alopecia, there are various medicines that are given for this, which usually is able to control the hair fall and maintain the hairline. And also, if you have, because of certain deficiencies or drugs, what we call as telogen effluvium, then we have to look at the cause. What deficiency is there and what nutrition we have to replace so that we are able to control the hair fall. Now, a lot of people say, are there any procedures that can be done? There are n number of procedures that can be done for hair falling hair or regain of hair or hair regrowth. So there is something called PRP, which is platelet-rich plasma, in which a patient's own blood is taken, which is from where the platelets are derived, and these platelets are injected into the scalp. So these platelets are big cells which are present in our blood, and they have a lot of growth factors, and these growth factors ultimately release themselves in the scalp, and this causes the hair growth, and it also strengthens your hair growth. Another thing that can be we can do some mesotherapies for hair loss. Apart from that, if hair loss had reached beyond a stage, then transplant is a very good option which can be done for hair fall or hair loss. And transplants from very good clinics are usually very successful. Patients are very happy after transplant, and it is one of the things which gives hope to people, even those who have extensive hair fall. So friends, don't worry if you have hair fall. Consult your doctor early, because the key is to diagnose it early so that you can be treated early. If you go beyond a stage where not much can be done, then the hair cannot be regained back. So the key point is diagnose your hair fall, the cause of hair fall early, and then only go ahead with the treatment, and I'm sure you'll get very good results. Thank you.